everyone. Welcome to episode 7 of The Breakdown with Rothman Orthopaedics. I'm your host, Alex Hammond. And this past March at the American Academy of Orthopedic Surgeons meeting in Chicago, Dr. Asif Ilyas, director of the Rothman Opioid Foundation, and Dr. Ari Greis, director of the Medical Cannabis Department, both physicians from Rothman, they presented studies that determined cannabis use can actually reduce opioid usage with those who suffer from back pain and osteoarthritis. So it's getting a ton of attention, and we're going to delve into their research findings to find out exactly what this all means. All right, so I'd like to welcome in Dr. Asif Ilyas, hand surgeon and director of the Rothman Opioid Foundation, as well as Dr. Ari Greis, physical medicine and rehabilitation specialist and director of the Medical Cannabis Department here at Rothman. Want to thank you both for joining me today and obviously discussing this topic. So first and foremost, before we kind of get into the topic of the day, just want to give you both the opportunity to walk us through your journey to Rothman Orthopaedics. So Dr. Ilyas, I'll give you the floor first as the returning podcast guest.
Sure, Alex, thanks. So how far back do you want to go? So
as far back as you'd like to take us.
Kindergarten onwards, so kindergarten, first grade, second grade, all the way through?
Preschool, actually.
So I'll try to keep it more interesting and brief than that. So after med school residency fellowship, I actually started practice in Philadelphia, but not at Rothman and Jefferson. I initially started at Temple University Hospital. I'm an orthopedic surgeon and a hand surgeon. And after spending 3+ years there, I joined the Rothman Institute and Thomas Jefferson University back in 2010. Been at Rothman ever since, and it's been an amazing ride. We've been expanding in so many ways, not just physically, but also just kind of in terms of caliber of the work that we're doing and the influence we're having. And I think some of the topics that Ari and I are going to talk about are a reflection of that growth as a company in practice. But I've been with Rothman for about 12+ years now.
Great. Thank you for that intro. Dr. Greis.
Yeah, so I returned from Seattle, Washington, where I did my residency in physical medicine and rehabilitation. And I did a fellowship with one of our current competitors. My fellowship was in sports and spine rehabilitation. And I thought I was going to stay on at that practice, and things didn't work out. So I was super lucky to get a job at Rothman Orthopaedics in 2009. And I had no idea that all of these opportunities were going to come my way as a result of being part of a really serious academic institution and with a focus on research and innovation. So for me, I kind of landed here by accident, but been all good since.
Appreciate that. So yeah, I just kind of want to get right into the topic because there is really so much, and we can obviously talk about both of your careers and the success that you've had along the way and obviously the growth. But, the reason why we're here today is you both presented, I think at 2 months at this point, the American Academy of Orthopedic Surgeons. Medical cannabis can reduce use of opioids in patients with chronic back pain and osteoarthritis. So it's been getting a lot of national, international attention. Dr. Ilyas, you served as a lead researcher of these studies. So kind of let's start from the beginning for, one of the things that many people may or may not know that, Rothman Orthopaedics, our physicians here are very much into research. So I kind of just want to start at the beginning, walk us through this research process. How did we get here?
Yeah, so I want to first say that Ari was the lead researcher in the studies, but we definitely collaborated and I've tried to help him as best I can along the way. But he's been really leading the charge with cannabis research. But just taking a step back for a moment for the sake of discussion, at Rothman Orthopaedics, we take pride in really doing innovative research and kind of setting the stage for the current practice paradigms of standard of care in orthopedics and musculoskeletal medicine. And one of those areas is pain management in orthopedics, musculoskeletal medicine, and medicine and healthcare in general. And my own personal interest in the pain management space began organically, kind of just with experiences with my own patients, and then starting to do research in pain management. And I realized early on that we can do much better as a community of healthcare providers in terms of pain management. And so my research started to grow and our scope of work started to grow in the pain management space. And then later, I had the privilege of serving as president of the Pennsylvania Orthopedic Society, and I spent a lot of time statewide on this issue as well. And I realized that not only was there a lot of room to improve our pain management and orthopedics and medicine in general, there was a lot of interest both on the patient side and the physician side. And all that work, culminated ultimately internally for us to kind of spend some dedicated time around pain management. So we started a 501c nonprofit organization known in short as the Rothman Opioid Foundation, where we decided that we can really kind of focus our energies around pain management strategies. And I can speak more about the foundation if you wish, but fundamentally, we are looking to innovate pain management. And so medical cannabis research is a natural aspect of that, because medical cannabis is something that is relatively new, at least in Pennsylvania. Broadly, it's relatively new across the country, and it's continued to grow in its utilization and growing in our understanding of it. So I was very supportive of looking at this, and we continue to be so. And obviously, as you mentioned, the Academy was very interested in our research today, which we can review obviously with you.
I appreciate that explanation, and sorry for getting that wrong in the beginning as far as the research. But Dr. Greis, speak a little bit about what you were hoping to find out when you and Dr. Ilyas kind of got together on this.
Well, I don't have the research background that Asif has. And I think that one of the things that's been inspiring about working at Rothman is, this attitude that we can always do better. And I think after being in practice for, close to 10 years and practicing in a pain management world that's inundated with, prescription medications and a real focus on opioids for pain management, especially when I was training and in fellowship, after a while, I think you realize there are obvious better ways of doing things and less harmful ways of managing pain. And I was somewhat familiar with the, little existing research on cannabis, but if you really look at the literature for cannabis, as much as people tout that it could be good for almost any entity or ailment, a majority of the decent research that's been done on cannabis shows that it's effective as a pain reliever. And, I think for thousands and thousands of years, people have been using cannabis as a pain reliever safely. And, when it became available in Pennsylvania, for me, it was really just a no-brainer that this was a viable option that we should explore. But, we have to really contribute to the literature on this plant and science. And, I really did need a partner to make this all happen. And, fortunately, Asif was there doing something in the opioid space. And I think, together we're really feeding off of each other's energy in terms of, best practices and trying to teach other clinicians, a new way of managing pain, especially when it becomes chronic and people are going to need to be on meds for a long, long period of time.
I want to jump, since you guys mentioned Dr. Ilyas's work with the foundation, but maybe discuss a little bit about the symmetry between both programs and why it is important for both of your programs to kind of partner and work together.
From my perspective, the whole purpose of introducing cannabis in our practice was to reduce opioid usage. So, we're relatively inundated with patients with chronic pain conditions. Many of them have been on opioids for years or afraid to use opioids because they're aware of the harmful effects or know someone who's been affected by opioid addiction. So I think, from the beginning, it was obvious that our goals were aligned.
Dr. Ilyas, anything to add to that, or just?
Absolutely. So by its very nature, I think it's complementary. If you look, just taking a step back from the foundation perspective, I wear the foundation hat for a moment. As a organization, our mission is threefold. The first is research. So doing research on pain management strategies that are opioid sparing, opioid mitigating, educating the public and prescribers on safe opioid use and prescribing respectively, and then serving as kind of like a think tank or a advisor to our legislators as they develop policies around pain management. So, medical cannabis is really a fascinating space that we're in right now. It's brand new, I think. I would say that we're in our infancy of understanding it. So I think as musculoskeletal leaders locally and nationally, I think it behooves us to kind of really look at this and make sure that we are trying to provide as much evidence as we can to drive best practices, and also to provide the best evidence we can for our legislators and policymakers to put forth the best policies and make sure our patients are using them right when indicated. So I think it's a natural marriage to look at this. And I think Ari's and Dr. Greis are doing a great job, like looking at this issue and making sure that we're rolling this out in a thoughtful manner so that patients fully understand kind of how to do this the right way. And we're learning as we go with this as well.
Great. Well said on both of your parts. But yeah, I want to rewind actually again, because like I said, since you mentioned again, working together and just it made sense for you both to partner together. But as far as going back to this specific piece of research, the participation, and is it safe to say that prime patient candidates, like how did you find, the people to participate? Like, what's that process like? And obviously you mentioned the people who suffer from chronic pain, but walk us through a little bit how you do find people to kind of participate in this.
We have an IRB through Thomas Jefferson that is for prospective data collection on all of our cannabis patients. And so what we essentially have done from the beginning is collect outcome measures from patients that were getting access to cannabis. And we basically looked at a subset of that population that was using controlled substances during the time of their certification. So a lot of our patients weren't using opioids or any other controlled substances to manage pain. But we specifically wanted to look at the patients that were using cannabis with, in theory, the attempt to stop using other controlled substances. And so we had a large amount of data to look at with patients that were using opioids 6 months prior to their cannabis certification and then 6 months after. And what we saw, I think, was really telling. And I think we can get into the details, a little bit later. But I think it was a nice way to look objectively at patients that were using controlled substances and then seeing if there was reduced use of those medications after having access to cannabis.
Can I just add one thing to
absolutely.
What Ari said? So fundamental to it, though, and again, we can parse out the studies that we presented at the Academy, because I think the data is really interesting, is making sure that we are collecting good data throughout the process. Because, we don't want to just be prescribing and certifying, but we want to be studying this. And again, that speaks to our broader mission here at Rothman to kind of lead in terms of research and education and advocacy. So that's really helping us understand it. And I'll be honest with you, the data for myself as well has been really fascinating because this is brand new space for us, and to see such a remarkable reduction in opioids is really amazing. So just to add one more thing to what Ari said. So fundamentally, we looked at the subset of patients for these two diagnoses, either low back pain or osteoarthritis. And so there's many people certifying, but we looked at just these subset of patients. And then we included patients who were taking opioids pre-certification for those complaints. And then saw post-certification, once it's were certified for cannabis and started utilizing cannabis for those same chronic pain conditions, what effect that had on their voluntary decrease on opioid use post-cannabis certification.
So I'm curious because, again, this is a study that has been getting a lot of attention. So you can answer as humbly or it's, because it really is just truly an honest question. But is it one of those things where I'm thinking about the time that we're in where, medical cannabis is in the news a lot, opioids is in the news a lot. So is this something that, again, is still kind of fresh, you would say, maybe in the orthopedic world? Like, is there not a lot of other people kind of looking at this kind of research? So I'm just curious to understand, if it's getting a lot of attention, is this kind of a new thing? Even though we take for granted, we think it is kind of just pretty popular, but maybe that's my perception, but just curious to hear your thoughts.
So I'll tell you, in the orthopedic community, it's pretty new. It's very new. So if you just look at the Academy this past year, and there's got to be thousands of presentations at the Academy every year, if not more, and more, if not more, like tens of thousands between abstracts and podiums and lectures. there's negligible data being presented on medical cannabis. Now, that's not to say in other spheres of medicine that they're not, but I'll say broadly, and as Ari and I have started to interface with more and more, pain management specialists and other doctors and other specialties who are interfacing with in the pain management space, it's very much new. And so the short answer is yes, but the longer answer is the more I realize it's new and the more I see kind of the quote unquote excitement around it, and we can talk about that a little bit, the more I realize that we have to really study this carefully to really understand it, because there's always good and bad with any medication, from Tylenol to opiates to whatever. So we have to look at this really critically. But yes, broadly, it's quite new.
Okay. Like I said, my perception is, again, because I think it's in the topic every day, but, curious. I think a lot of people, lay people like myself, and obviously being in this world, I know better, but many people will just automatically think, or their first thing when they hear orthopedic surgeons is, one, they're going to cut me open, and two, they're going to give me opioids. So that's kind of just the misconception, again, for people that are unfamiliar and kind of like, wait, what? You guys have a Rothman Opioid Foundation, or you have a Medical Cannabis Department, and you're kind of, steering away from that, or you don't, recommend surgery right away. So it's kind of like all those things that I'm assuming you guys are trying to dispel those myths.
And I think it's important for the listeners to know as well that the other way you can know that it's new is, first of all, Pennsylvania only legalized medical cannabis. Was it 3 or 4 years ago, Ari? 2016.
2018, the law went into effect, but it was passed in 2016. So
that's 3 or 4 years ago, and so it's quite new in the state.
Right.
And then nationally, there's only 33 or 34 states that even allow for use of medical cannabis, and those numbers keep increasing. So even, nationwide, it's relatively new. So there's certain states who've embraced it much earlier. But even if you look in just our region between, Pennsylvania, New Jersey, New York, it's relatively new in just the past few years. So it is early on.
And I would just say that, the answer to that question is it's new. And at the same time, it sort of isn't. If you look at the cannabis research, a majority of people use cannabis as a medicine to treat pain. That's the number one reason. And that's, supported by some of the evidence showing that, it's effective for managing chronic pain in adults. I think what we're doing, though, is really expanding that knowledge base by looking specifically at orthopedic, patients that have specific diagnoses that are being followed with, specific validated outcome measures for their condition. And, I think our research methods are getting better, but we're also getting more specific about which types of patients could benefit from it, which type of products might be most successful and have the least amount of side effects. And so I think, like any topic in medicine, we're making these advancements because, it's layering knowledge base on top of knowledge and learning more as we go. And so I think for some people, it's not surprising our results. And those are the people that understand something about cannabinoids and how they work on the body. But in the orthopedic world, knowing that this may be a viable option as opposed to opioids, I think that's definitely very new.
You both actually mentioned, or the study actually mentions, that more research needs to be done. So what, and I guess maybe because it still is in this infancy stage, but kind of after, you have this, when would you look at it again, or when would you reevaluate, or what more needs to be done?
And there's more data that we'd like to have. And I think from a clinician perspective, one of the issues is we aren't taught anything about the endocannabinoid system in medical school. No one has experience recommending cannabis products. And so what we're trying to do is also come up with dosing guidelines. And, we don't know what the most effective combinations of THC and CBD, which are the two most available chemicals in the plant, which dosages are most effective. At what point does side effects or other levels of intoxication start to kick in for most people? So, I think there, like any other drug study, there's a lot we need to learn about safety and tolerance and efficacy. And so, the more we learn about the type of products that patients are using in the state, the more data we'll have to present.
And just to add to that, Alex, is so beyond that information, which we absolutely need: dosage, frequency, efficacy, delivery route, et cetera, complication profile, drug reactions, et cetera. Also, if you look at it from an orthopedic or a surgical perspective, what's its best indications? Chronic pain, acute pain, post-operative pain, cancer pain. And that's just the pain space. And then cannabis is being used for a slew of other non-musculoskeletal diagnoses as well. So it's growing, but I think that, from an orthopedic perspective, it's relatively new. I will add just one more thing. So this is not the paper we're discussing, but we did a study last year that I think will be interesting for your listeners, where we surveyed 2,500 patients coming to the Rothman Institute for various musculoskeletal complaints. So any list of conditions that they're seeing in one of our musculoskeletal specialists or surgeons for, and to see what their impression and perspective on medical cannabis was, just like what they thought about it. And the data that was most shocking to me was that 9% of patients who were being asked these questions were already taking medical cannabis in some form for some diagnosis. So almost 1 in 10 were already using medical cannabis, not necessarily for the diagnosis we're discussing, but just taking it on a medical basis. So that's a huge number. So although it's new in terms of our research, to Ari's point, it's not new in terms of its utilization. And I think as utilization is going to continue to grow.
Yeah, we'll definitely have to revisit that when that's done. And just curious, so how long will that process kind of you continue to look at that data? When will that kind of be officially done?
So it's actively being done. So one of the things that we're always doing is looking at the data that we're collecting and also make sure that our outcome measures are up to par in terms of getting the data that we want. Cannabis is challenging, though, to study. I think it's just worth mentioning here that unlike most medications, we can't do standard controlled trials of it. And Dr. Greis can talk more about this, but, cannabis is a controlled substance. So we can do a randomized trial in the traditional sense readily, like where you can get either drug A, which is cannabis, and drug B, which is something else, and then we can observe or give you different dosages of cannabis or different deliveries of cannabis because it's still controlled. So it's difficult to do this kind of traditional studies without special research licenses. So that makes it a little bit more challenging to do, but the imperative is still there to pursue that type of data.
Gotcha. So we imagine there probably are many potential patients who absolutely don't want to be treated with opioids. So what would you say to patients out there? And obviously, you mentioning the study, who might be hesitant to seek treatment for their orthopedic issues because they don't want pain meds. So
you mean, what would you say to them in terms of using something as an alternative to opioids?
Yeah. And again, maybe it's kind of going along with, the study, Dr. Ilyas, that you're kind of looking at right now, but with people's kind of impressions of cannabis. So what would you say to potential patients, again, because like I said, they think surgery or opioids?
Yeah, I think there's obviously lots of misconceptions out there when it comes to opioids and cannabis and, alternative pain management options. I think one of the most interesting things that we've discovered by asking patients about side effects and levels of intoxication is that I would explain that close to half of our patients that are using cannabis aren't experiencing any intoxication whatsoever. And I think that's really important because most people assume medical marijuana equals I'm high all day or I'm high when I use my medication. And, I think everybody is mostly looking for a way to alleviate symptoms, but to remain in control and to be able to function and, perform, life's duties. And, I think sharing our experience that even elderly patients who are on a variety of other medications can oftentimes find, one or two cannabis preparations that is helpful and doesn't cause a lot of side effects or intoxication or drug interactions. And I think that's really reassuring. And the fact that it's easier to stop using cannabis without levels of, physical dependence or risk of psychological addiction, makes cannabis a safer option. But, I think at Rothman, when we practice chronic pain management, we really do practice multimodal care. And it's not one thing that's going to help most of these patients. It's a variety of modalities. And, I just think that having access to some of the products, can really be useful and safe and effective for a lot of patients.
Great.
Yeah, just to add to that, and a couple of things I want to just comment on. So first of all, it's generally not a binary choice. It's generally not, opioids or surgery. There's one of the great things about what we do is there's a lot of ways to treat conditions. And as Ari said, one of the things that is the mainstay of pain management in orthopedics, and particularly what we here at Rothman advocate is a multimodal pain management strategy. So almost whether you're doing chronic pain or acute pain or post-op pain, there's a combination of things that we should employ in order to control someone's pain experience. So that's really important. As it stands right now, in terms of our understanding of as at least in my understanding of cannabis right now, our best data for the use of cannabis is in the chronic pain space. And not to say that in time with research and analysis, it may now have indications in the acute pain and the post-op pain space. Right now, it's in the chronic pain space. So it's definitely an option for folks. Particularly, I think if I had to pick one subset of folks, and that our studies kind of focus on that subset, is those that are opioid dependent to manage their chronic pain. Because the problem with opioid dependency for chronic pain is you have to keep taking more and more opiates to achieve the same level of pain control. And that's one of the big issues around it. And then the risk of dependency and side effects increases. So I think that's probably the most ideal right now. But I think our understanding of the indications for use of cannabis will continue to grow with time.
Great. I would say before we wrap up, what is the takeaway for patients or for other surgeons or for anyone who treats patients? What would you say is the biggest takeaway or that you're hoping people get from this research?
My general takeaway is that, there's a way to use cannabis safely and effectively to treat chronic pain. And, I think it's a viable option. I don't think it needs to be a last resort after patients have failed all other modalities. And I think there's a lot more that we need to learn about it. And we're only going to get better at this. But through exposure and education and experience, I think other clinicians will learn that this is a useful option, that it's just like most other medications that we already prescribe, and there's no reason not to embrace it.
Great.
I totally agree. And I would just say in the spirit of multimodal pain management, particularly in the chronic pain setting, it's just one more tool, one more mechanism and ability for clinicians to improve patients' pain experience, particularly in the chronic pain space. But again, as we've said it several times, it's really early on. We need to do a lot more research, and we're going to continue to champion that research here.
I want to give you both the floor, I guess. Appreciate that takeaway. But anything else that you want to add before we end here, or final thoughts? I always like to give our guests their little elevator pitch. It could be about both departments, the foundation as well as the cannabis department. If there's anything you want to add about those, feel free.
I don't know if this is appropriate, and I don't want to make this a political issue, but I think that if, people really believe that, they should have a right to access cannabis to use as a medicine, that, they should consider this a serious topic, and to vote for elected officials that are going to do something to change, our current federal legislation on the topic.
Absolutely. Thank you for that.
Yeah, I think, Alex, I think you can end with where we kind of talked about our final thoughts on the future of research and utilization. I think it was a good way to end it.
Yeah. And like I said, when the research that you mentioned is complete, we'll definitely have to do a follow-up to that. But want to thank you both, Dr. Greis, Dr. Ilyas, for joining me today on this hot topic. So hoping that our listeners, they hear it, they listen, they read about it, and, appreciate all the hard work that you both do for Rothman Orthopaedics. So thank you again for joining me.
Thank you. Our pleasure. Thank you.
I'd like to thank Dr. Greis and Dr. Ilyas for joining me today. Please visit our landing page, rothmanortho.com/podcast for all available episodes. We're on Spotify, Apple, Google, and a few other listening platforms. So make sure you subscribe, like, and share on whatever platform you utilize. Thanks again for listening. And until next time, take care.